menstruation. She menstruates 2 times in a month, and she goes through pains. And they said she has been bleeding. And the doctor said if they are going to operate it, that means they will remove the womb. Finally, she won't be able to conceive again. So I just don't know what we can do about this.
All right. Okay. You got everything.
Yes. You see, one doesn't have direct access, to the complete information, take a decision. However, the rule is that if a woman has fibroids and she's bleeding heavily, how do you know you are bleeding heavily? You start seeing lumps of blood during menses, or it's prolonged beyond 7 days. She needs to be treated. Surely needs to be treated. Now, one of the problems I've seen is that a lot of people go for normal scan, which is done through the abdominal ultrasound scan, which is quite common. Now, that scan to a large extent is quite good in a woman who is pregnant, because the womb has expanded because of the pregnancy, so you can see things easily. But for a woman who is not pregnant, it can be a bit difficult and tricky, except you are very experienced. So you can miss a lot of pathologies. A fibroid of even 1 centimeter, you know how small 1 centimeter is? 1 centimeter, if it's in the cavity, that's a submucous fibroid, can cause heavy menses. And if you don't take it away, she will keep on bleeding and she might not be pregnant. So if you do a scan through the vagina, that's a transvaginal ultrasound scan, it sees clearly what's going on. If there's any doubt, we normally pass a camera hysteroscopy to be sure. However, sometimes we mistake fibroids or mistake adenomyosis for fibroids. There's a condition called adenomyosis, which can present with heavy menses and painful menses, but it's not fibroid. So you don't have something to hold on to pull out. So at times, the explanation to the patient might not be very clear to understand that what she has is adenomyosis. And to a large extent, most times you can't really do much about them, say we take out the womb. So I'm hoping it's not adenomyosis that they are dealing with, but they probably need more investigation.
All right, sir. Right. Yes. Okay, let's take another call. Do we have a WhatsApp call? Don't forget WhatsApp number 08095